Okay. So we're going to take up two topics today. The first one will be your basal nuclei, and the other one will be your limbic system. So let's take up the basal nuclei first, formerly known as the basal ganglia. Uh, we're going to describe first the composition of your basal nuclei, its functions, its connections, and at the last part, of course, the common clinical conditions affecting the basal nuclei. Now, firstly, let me just say that the term basal ganglia was the former term, and it's actually a misnomer, no? Because as you well know, when you say ganglia or ganglion, these are supposed to be located, no, gray matter located outside the CNS, whereas these structures are actually located specifically within the cerebral hemisphere. No? So again, the term basal ganglia is now basal nuclei or basal nuclear masses. Okay? So these structures play an important role in controlling posture as well as voluntary movement. And they include the following structures, no? Your corpus striatum, the amygdaloid nucleus, and your claustrum. So let's take up first the corpus striatum. When you say corpus striatum, these are structures located lateral to the thalamus. So here in the picture, you can see the thalamus, and the structures located lateral to it include both the caudate nucleus and the more lateral, of course, is your lentiform nucleus. No? So these two structures make up what we call your corpus striatum. And as you can see, they are divided specifically from the thalamus by this V-shaped white matter, no? What we call your internal capsule. Now, as to the internal capsule, again, we may say that it has certain parts as well, no? So this upper portion here is what we call the anterior limb. The part here is the posterior limb. And in between them, you have this angle, what we call the genu. So again, the parts of the internal capsule, which as you can see is V-shaped, is the anterior limb, the posterior limb, and the genu. Now, of course, when you see the caudate nucleus, you know that this is already on the more anterior portion of your cerebrum. So again, these are the parts of what we call your corpus striatum. Let's take up first briefly the caudate nucleus. So caudate nucleus refers to this C-shaped mass of gray matter, which we will describe in a little while as its relationship with the lateral ventricle. No? Also, you may find it closely lateral, no, or lies lateral to your thalamus. You can say that the caudate is divided into three parts. It has a head here, a body, and again a tail. Okay. Let's describe the head first. The head, as you can see here, is large and rounded, and it's said to form the lateral wall of the anterior horn of the lateral ventricle. So again, this is the lateral ventricle. As you well know, it has several horns, 3 horns, and a body. No? So this part here again is of course the anterior horn. There you go, as identified here. So the head of the caudate is found lateral, no, to your anterior horn of the lateral ventricle. Further, you will note that your caudate head will continue inferiorly as the putamen. So usually we'll say that these two structures are contiguous or continuous with one another. Again, the caudate nucleus is continuous with your putamen. Now, regarding the caudate body, again, this one here is the caudate body, and here on the other hand is your lateral ventricle. We say that the caudate body is long and narrow, and it is continuous with the caudate head here at the level of this foramen, which is your interventricular foramen of Monroe. No? So when you see the interventricular foramen of Monroe, that is the point where the caudate head becomes the caudate body. Now, as to its relationship to the lateral ventricle, apparently it is found at the inferior aspect or below the body of the lateral ventricle. Ayun, no? So, kumbaga, nasa taas si lateral ventricle, nasa baba si caudate body. So, body sa taas ng lateral ventricle, body ng caudate sa ilalim. Now, what about the caudate tail? So, this is the caudate tail. Again, it is described as long and narrow, and it's continuous naman with the caudate body at this point, which is described as the posterior end of your thalamus. If you look at this, the letter D is actually for the diencephalon. So this is the thalamus here, no? As you can see, it's egg-shaped. So this is the thalamus, and at its posterior end, so ito po posterior end, is supposed to be the point where your caudate body continues as your caudate tail. Further, no, if you look at your caudate tail, it actually ends forward. Ito po, ends forward anteriorly as your amygdaloid nucleus. Ayan, no? Now, again, in relationship to the lateral ventricle, it is naman related to the inferior horn of the lateral ventricle, where it is now found at the roof or above the inferior horn of the lateral ventricle. So, nasa taas naman siya ngayon. No? Ang tail natin is above the inferior horn of your lateral ventricle. So, those are the relationships between your caudate nucleus and the lateral ventricle and the structures contiguous to it. Again, don't forget, the head is contiguous with the putamen of the lentiform nucleus, and the tail is contiguous with your amygdaloid body. Now, let's look at the lentiform nucleus. So this is your lentiform nucleus. As you can see, it's wedge-shaped, where its base, no, this one is the base, is pointing laterally, whereas the blade, so this one naman is the blade, is pointing medially. Now, what are the relationships of your lentiform nucleus? Firstly, of course, again, medial, you find the internal capsule, and at the lateral aspect, you find a narrow sheath of white matter, and that is what you call your external capsule. So external capsule on the lateral aspect, internal capsule on the medial aspect. Now further lateral, you will see naman a thin sheet of gray matter, and this is of course your claustrum. Okay? Now going back to your lentiform nucleus, you will note that there is a thin plate of white matter that divides your lentiform nucleus into two parts. You have a more lateral, darker portion, which is what we call the putamen, and a more medial, lighter portion, what we call the globus pallidus. Now, apparently, the reason why the globus pallidus is paler in color is that it has a higher amount of myelinated nerve fibers. No? So this will be the thing regarding your lentiform nucleus. Now, regarding the amygdaloid nucleus, you find it mostly in the temporal lobe, no? Specifically quite close to your uncus. As you know, The uncus is located somewhere here, no? So if we look at it, it's supposed to be here at the back, no, of your amygdaloid. Okay. So the amygdaloid is also considered a part of the limbic systems. We're going to discuss it also later on, no? So it apparently influences the body's response to environmental changes. So look at the example here. Fear is an example of your environmental change, which can cause changes in your heart rate, blood pressure, respiratory rate, specifically causing an increase in these vital signs. Now, can you tell me what will be the effect of fear on your skin color? Anong magiging epekto ng takot sa balat ninyo, sa kulay ng balat ninyo?
Pale po.
Yon, correct. Di ba? Sabi nga sa Tagalog, namutla sa takot. Okay? So again, these are the things related to the body response to environmental changes. Okay? So let's go look now at the claustrum. So we already identified the claustrum as this thin sheet of gray matter, no, that we said is found lateral to your lentiform nucleus. Again, no, we said that in between these two structures, the claustrum and the lentiform, is this thin sheet of white matter, what we call the external capsule. Now, further lateral to the claustrum is again a thin sheet of white matter. This time we call it the extreme capsule. And most lateral, no, again we find gray matter, and this is already your insula. Okay? So these are the things that you may find regarding the claustrum, no, relationships to the claustrum. Now, as to function, apparently at the moment, the function is still unknown, no? Kaya siguro at the moment, still very narrow because the function is not so well shown or obvious, no? Later on, baka pag makapal na yung claustrum, makikita na natin function. Okay? So these are the terminologies that you should know. The caudate is now known still as the caudate nucleus. The lentiform refers to the globus pallidus and the putamen, and the claustrum is still the claustrum. When you say corpus striatum, that refers to both, again, the caudate nucleus and the lentiform nucleus. Whereas this new term, no, neostriatum or simply striatum, refers to both your caudate nucleus and your putamen. No? Kasi remember, these are the two structures contiguous with one another. And then paliostriatum actually refers to your globus pallidus, and amygdaloid body nowadays is preferably called the amygdaloid nucleus. Now, again, we just like to point out the term basal. Why is it called basal nuclei? Because as you saw in the pictures, these nuclear bodies are located at the base of the forebrain, or actually they are located subcortical, no, below the cerebral cortex. Okay? So these are the things related to your basal nuclei. Now, what are the functions? No? Firstly, we make specifically point out, no, that with regards to impulses that are going into the basal nuclei, they are received by both the caudate and the putamen. Whereas impulses that will go out of the basal nuclei will be specifically going out through the globus pallidus. Now, again, we make mention that your basal nuclei influences activities of your motor areas like your motor cortex or cerebral cortex and the brain stem, no? So in other words, it influences activities of your motor centers, except, no, the spinal cord. Apparently, there is no direct input nor output to the spinal cord. So look at the picture here. So this is the cerebral cortex. As you can see, it is interrelated with your lentiform nucleus here, with both the putamen and the globus pallidus, with your caudate nucleus, with your thalamus, of course, and of course with the midbrain, specifically through its substantia nigra. But as you can see in the picture, only through the cerebral cortex can we get to your spinal cord, no? So no direct relationships with the spinal cord here. So these are the connections of your corpus striatum as well as of your globus pallidus, no? Now, as to the nomenclature, note that if a tract or a connection is going towards the basal nuclei, the second part of the name is where we find your nuclei, no? It's the striate. We say striate or striatum. That's the second part in the name. That's when we say afferent, whereas if it's efferent, meaning it's going out of the basal nuclei, the first part of the name is the striatum. Okay, so likewise here, you will see that whereas with the globus pallidus, no? So the pallidus naman is the second part of the name. It is afferent, whereas if it's efferent, it is the first part in the nomenclature. Okay, so these are the things regarding the connections of your basal nuclei. Now, again, we reiterate that the basal nuclei assist in the regulation of voluntary movement and in the learning of motor skills. However, it is also said that the nuclei not only influences execution of a particular movement. So again, ito po yun, di ba? Influencing movement. But it can also help prepare for the movement. So apparently, this is achieved by first controlling the axial and the girdle movements of the body, and later on positioning the proximal parts of the limbs. With that, if your proximal part of the limb is already positioned, we now enable the trunk and the limbs to be placed in appropriate positions before we can move the hands and the feet. No? So for example, you're going to, ano ba yan? Play basketball, no? And specifically, you're going to shoot the ball. So here, no, the first part, of course, is the eggshell and the girdle position, no? So the body becomes a little tilted, no? And the girdle, of course, puts the upper extremity, no, in the upper, elevate niya konti ang ating upper arms. And with that, later on, will follow your hands that will then shoot the ball. Ayun. No? So, ayun po. No? Una muna, eggshell and girdle. Then the proximal part. And lastly, of course, the positioning of the hands. No? That is in relation to your, ayun, sabi natin, preparing for a movement. Okay? Now, what about the disorders? There are two general types of disorders. You have what we call the hyperkinetic, where you have excessive and abnormal movements exemplified by these following conditions. And you have your hypokinetic disorders, which is a lack or slowness of movement. We specifically point out the Parkinson's disease because this disease includes both types of motor disturbances. Okay? So let's point out first Korea. Remember, these movements are involuntary kasi di ba nga supposed to be voluntary ang ina-affect natin, but here you have involuntary movements where Korea is said to be quick, jerky, and irregular but non-repetitive. So you usually see this as a swift grimace or a sudden movement of the head or the limbs, no? So it usually affects the head or the limbs. Okay. Now, we have a specific disease here, what we call the Huntington disease, which is an autosomal dominant inherited disease. Ibig sabihin, sigurado magkakaroon ka kasi autosomal dominant. No? So it usually occurs in adult life, and that usually occurs 15 to 20 years after onset. Sigurado mamamatay ka. So it usually occurs equally in both sexes, and it reveals only after they had had children. Nako. And the medical treatment at the moment is still disappointing. What is the lesion? You have a degeneration of your GABA secreting, acetyl secreting, substance P secreting neurons of the striato digral inhibiting pathways. Anyway, the overall effect is an increase in the dopamine secretion of the substantia nigra. So overall effect, increase dopamine. Okay. So what are the characteristic signs and symptoms? You have choreiform movements, which usually first appears as involuntary movements of the extremities and twitching of the face. But later, when more muscle groups are involved, the patient becomes immobile and eventually unable to speak and swallow. Ayon. Now, this is a severe symptom now where you eventually develop progressive dementia. And this is with loss of memory and intellectual capacity. So dementia, of course, is state of the mind, no? It's a psychiatric problem, actually. Okay? So anyway, so Sydenham chorea, or what we call St. Peter's disease or dance, is a disease of childhood, no? You find here rapid, irregular, involuntary movements of the limbs, the face, and the trunk, and it's associated with rheumatic fever. Bakit rheumatic fever? Apparently, the antigens of the Streptococcus bacteria is similar in structure to the proteins of the membranes of the striatal neurons. So in other words, napagkamali, no, napagkamalan lang na antigen na, no, instead of the streptococcal antigen, napagkamalan na antigen yung protein ng membranes ng striatal neurons, no? So ayan. Kaya nag-act doon yung antibodies natin, no? So we have here choreiform movements, which are fortunately transient or temporary and with full recovery. That will be Sydenham chorea. Then we have hemibalismus, no? So as the term says, you have involuntary movement confined to only one side of the body, kaya nga hemi, where the limb suddenly flies out of control in all directions. Bigla na lang lumilipad yung ating limb, no? And it usually involves the proximal extremity, sabihin yung upper extremity natin, no? It usually is due to a small stroke in the opposite subthalamic nucleus or its connections. Ibig sabihin, kung ang lumilipad na extremity is the right, Then the lesion is in the left subthalamic nucleus. Lastly, we have atetosis, which is described as slow, sinuous writing movements. So, ang ating comparable dito ay yung parang naghahawayan ng kamay, no? It commonly involves the distal segment of the limb. So, ayun nga, snake-like movements, no? Diba? That is what you do when you do the Hawaiian movements of the hands, diba? And the lesion is due to degeneration of the globus pallidus. Okay? So let's discuss now the Parkinson's. So this one is also a progressive disease of unknown cause, usually starting at 45 to 55 years of age. It's usually associated with neuronal degeneration in your substantia nigra, or sometimes at a lesser extent of your basal nuclei, no? Your globus pallidus, in other words, your corpus striatum, no? Globus pallidus, putamen, and caudate nucleus. And the overall effect is this time a decrease in dopamine release. So what are the signs and symptoms? You have rigidity, and it may be seen with or without tremors. If it's without tremors, you say plastic rigidity. If it's with tremor, you say cogwheel rigidity. Now, the tremor here is usual. If you may also see, of course, tremor, no? Where the tremor is usually slow and occurs when the limbs are at rest and usually disappears when the patient goes to sleep, no? So ito po yung mga nakikita nating matanda, nakaupo, tapos gumagalaw yung mga kamay, no? Nagtitwitch yung kamay. Okay? So these are what you see, no? Another thing is what we call bradykinesis. This is difficulty in initiating and performing a new movement, or what we call akinesia. You'll find slow movements, expressionless face, the voice is slurred and unmodulated, and you find that when the patient is walking, swinging of the arms is lost. No? So ito po yung when the patient wants to walk, starting to walk is difficult. Sabi nga natin, there's difficulty in initiating, no? And then again, it's also difficult to stop walking, no? Kasi that's also performing a new movement, stopping movement, di ba? So ayun po, it's very difficult. You have a difficulty in starting to walk, and then you also have a difficulty in stopping your walk. Okay. Now, for postural disturbances, you may see the patient standing with the stoop and the arms are flexed, with walks with short steps, and again, as I said, often unable to stop. Now, although remember, the problem is involuntary movements, but there is no loss in muscle power nor loss in sensibility. There is the corticospinal tracts are normal, your reflexes are normal. Babinski, of course, is not seen, no? Kasi Babinski is only normally seen in the first year of life of an infant, diba? Yeah. So any questions regarding the basal nuclei?
None po so far.
Thank you. So let's move on to the limbic system. So for the limbic, again, we're going to look at its components, the functions. We're going to briefly point out the PAPE circuit, and at the last part again, some common clinical conditions related to your limbic system. So the term limbic means border or margin, because the structures here that make up the limbic system are found in the border zone between the cerebral cortex and the hypothalamus. Apparently, the system is involved in the control of emotion, behavior, and drive, but now it appears to be more important in memory formation. Okay? So these are the limbic structures. Firstly, you find here, right underneath the corpus callosum, this portion, what we call the subcallosal gyrus, which if you continue upwards, actually is also continuous with your cingulate gyrus. No? So these are the first two structures we're pointing out, the subcallosal gyrus and the cingulate gyrus. These are the two structures that you find superiorly. Now, here inferiorly, we also have, of course, the parahippocampal gyrus over here, no? Which we already saw at the inferior aspect of your cerebrum. The hippocampal formation, the amygdaloid nucleus, so this one. So here we find the hippocampus, which is just part of the hippocampal formation. No, ito pong purple part. No, this is the hippocampus. Then you also have the mammillary bodies, which if you remember, we discussed this in relation to your diencephalon. And again, also the anterior thalamic nucleus, which is the single nucleus of the anterior part of your thalamus. Diba? Ayan. Now, we also make mention of the connecting pathways of the limbic system. We have the alveus, the fimbria, the fornix, the mammillothalamic tract, and the stria terminalis. Okay, let's look at these structures. Now, firstly, let me just say, I'm not going to discuss anymore this first two because this will be discussed in the cerebrum. These last two will be discussed in your diencephalon. So only these parts in red will be discussed today. So let's start off first with your hippocampal formation. There are actually three structures that make up the hippocampal formation. Firstly is the hippocampus. Again, we say that is the purple part. The dentate gyrus, which is the blue part. And also your parahippocampal formation. So in other words, so pong tatlong ito makes up your hippocampal formation. Let's discuss first the hippocampus. Again, the purple part. Yeah. So the hippocampus is a curved elevation of gray matter that extends throughout the entire length of the floor of the inferior horn of the lateral ventricles. Again, ayun po ang ka-relationship niya, no? Yung inferior horn of the lateral ventricle. The term hippocampus came from the word seahorse because the hippocampus resembles a seahorse in coronal section. I'll show you this in a little while. Now, the pes hippocampus refers to its expanded anterior end. So let me just show you now. This entire structure here is your hippocampus, where you see here at the anterior end, the pes hippocampus. No? So yan po yung pes hippocampus. Now here I'd like to show you the hippocampus on coronal section. As you can see, it's really like a seahorse on coronal section. Now, what I'd like to show you next is the white matter related, no, that you will see in relation to the hippocampus. Firstly here, at its convex area related to the ventricle, no? So ayun po yung ventricle sa likod niya, yung space na yon. You find here at the convex surface what we call the alveus, no? Ayun, no? You find a thin layer of white matter that we call the alveus. So the alveus will then turn medially to then form the fimbria. So again, if we convert this to this, you will see the alveus supposed to be here, di ba? Sa convex portion nga niya, di ba? So the alveolus is supposed to be here. It will turn medially, so pupunta po dun sa may gitna. And here now will be on the upper surface of your hippocampus, which will now form or converge to form your fimbria. So ito na ngayon ang fimbria natin. The fibria again will eventually go upwards to become what we call the crus of the fornix. Yeah. So these three parts that we have mentioned are already the parts of what we call the connecting pathways of the limbic system. So tatlo na agad na mention natin, no? So ulit, you have the alveolus here that will converge medially to form the fimbria, and the fimbria will continue upward to form the crus of the fornix. Now, lastly, we make note that the hippocampus ends here at the posterior end of the corpus callosum, specifically at its splenium. So here, this is the splenium of the corpus callosum. So the hippocampus ends here posteriorly at the level of the splenium of the corpus callosum. Ayun. No? So yan lang po ang ating, this structure is your hippocampus. All right. Then let's go look at your dentate gyrus. So this one is dentate. It is described as a narrow notch band of gray matter found between the fimbria of the hippocampus. Remember, the fimbria is supposed to be here on the upper surface, and your parahippocampal gyrus. So ito pala, medyo hindi ma-represent sa picture. Ano? Anyway, so posteriorly, no, let's follow the dentate gyrus posteriorly. It will continue over the superior surface of the corpus callosum as a thin vestigial layer of gray matter, what we call the indusium gricium. Ayan. No? So yan po, no? As you can see, it's gray matter. It's a thin vestigial layer of gray matter over the corpus callosum. We call it indusium gricium. Okay? Then also, if you follow naman the dentate anteriorly, it will actually continue with the uncus over here. Ayan. No? So these are the continuations of the dentate gyrus. Okay? Now, lastly, we speak of the parahippocampal gyrus. Ito na po siya, di ba? That's the parahippocampal gyrus. And again, we find it between the hippocampal fissure over here and the collateral sulcus here. Ayan. No? So that's the location of your parahippocampal gyrus. Further, it is said that it is actually continuous. Ito po, no? Parahippocampal gyrus is actually continuous with the hippocampus here, no? At the medial edge of the temporal lobe. So, kung pupunta pala tayo dito, we make slip here, you'll be able to see your hippocampus over your parahippocampal gyrus. Ayan. No? So these are the things regarding your parahippocampal gyrus. Okay. So the amygdaloid, again, no, we said is a part of the limbic system. It's situated at the anterosuperior end, no, of your inferior horn of the lateral ventricle. Remember, the inferior horn is here, no? So sa tip ng inferior horn of the lateral ventricle, you will find also the amygdaloid nucleus. Now, apparently it has two functional groups, the corticomedial and the basolateral, but there were no further descriptions as to these two functional groups in our book. Okay? So, minention lang na it has two functional groups. Okay? Anyway, let's go look now at our connecting pathways. We already described the alveolus. Don't forget, when you say connecting pathways, these are made up of nerve fibers, no? Usually myelinated nerve fibers. So the alveolus, you find it here, as we said, at the undersurface of your hippocampus, specifically at its convex surface. Then it went medially, di ba, to form the fimbriae at the upper surface of your hippocampus. So ito na po tayo, fimbria. Then the fimbria, as we said, goes more posteriorly to become continuous eventually with the crus of the fornix. So ito na siya, no? Crus of the fornix. Then the crus of the fornix moves anteriorly to form the body of the fornix here. And the body of the fornix will further split anteriorly. So ito na po, it splits anteriorly to form two columns. And by the way, these two columns are hidden because they are found lateral to your third ventricle. So nasa likod pa ng third ventricle. No? So eventually, these two columns will reach, of course, your mammillary bodies, which we found inferiorly to these structures. Diba? So ito na yung mammillary body. So the mammillary body naman will connect with your anterior nucleus of the thalamus to form what we call the mammillothalamic tract. We'll show you that in the next slide. So these are all the connecting pathways already. So the number 4 is this one. Yun, no? So we have here the mammillary body, and we see it connecting with the anterior nucleus of the thalamus. Diba? Ito po yung thalamus natin. Ito po yung anterior part. And that's the anterior nucleus. So that one is your mammillothalamic tract. Now, the last pathway is your stria terminalis. So the stria terminalis is supposed to arise from the posterior end of the amygdaloid. So this is the amygdaloid. So this is the posterior end, and this one is your stria terminalis. Ayan, yung blue, no? Identified as the stria terminalis, which will eventually come, as noted here, to lie in the floor. So sa ilalim of the body of the lateral ventricle. So here, no? Underneath the body of the lateral ventricle. Ayan. Okay? So these are the pathways of your limbic system. So we have a note here which says, limbic structures are not only interconnected, but they also send projection fibers to other parts of the nervous system. Physiologists now recognize that the hypothalamus is the major output pathway of your limbic system, no? So ang output pala ng limbic natin is via your hypothalamus. Remember, the hypothalamus is mainly related to your behavior, di ba? Yung mga satiety, mga temperature, and so forth, di ba? So this is also, as noted here, the major output pathway of the limbic system. Now, as to functions, the limbic influence many aspects of emotional behavior, no? Specifically through the hypothalamus, its connection with the autonomic nervous system, and its control with the endocrine system. So there are 3 systems, no, that are related to your limbic here, no? Hypothalamus of the diencephalon, the autonomics, and lastly, the endocrine. It says that it includes the reactions of fear and anger and the emotions associated with emotional behavior. With sexual behavior. Sorry po, late lang. Na-sneeze ako sandali ha. Okay. Also, apparently, the limbic converts, as I said kanina, di ba? Recent memory to long-term memory. Ang dali pa. Okay. So the function is attributed mainly to your hippocampus. No? So the lesion of the hippocampus results in the inability to store long-term memory. And this condition is what we call anterograde amnesia. So in anterograde amnesia, memory of remote past events are unaffected, but you cannot form long-term memories. So ano pong example nito? Yung pong nakita natin sa 51st dates. That's the example of your anterograde amnesia. No? So injury to both the amygdaloid and the hippocampus produces a greater memory loss than to injury to either one alone. Apparently, there's no relationship between the limbic system and the olfactory function. Ibig sabihin, yung mga memory ng naamoy na ninyo is not related to what was formed in the memory of your limbic system. No relationship. Okay? So lastly, we speak of the Paved circuit. The Paved circuit was originally known as also as the medial limbic circuit and is said to be for the control of emotional expression. Yun yung initial, no? This was proposed by James Paves in 1937, and the circuit connects your hypothalamus to the limbic lobe and is supposed to be the basis for emotional experiences. The circuit begins with the hippocampus and ends with the hippocampus. So Paul MacLean reconceptualized the Paves proposal and eventually coined the term limbic system. Now, ito na po yung pinaka-crew, no? This was what I was telling you. Recent studies show that the limbic system has a more significant role in memory functions than in emotion. Ayan. So nowadays, it's more important pala in memory formation rather than in emotional behavior. Okay? So, any questions at the moment?
Wala naman po.
Kala ko natulog kayo. Okay, thank you. Kung no question,